Discover the latest health tips, expert advice, and inspiring stories. This is the Health Channel Podcast. Your journey to better health starts now.
A screw placed a few millimeters off, a fused vertebra that never fused, a procedure to end pain that ends up making things worse. If your spinal surgery did not go as planned, you are not alone. Today we'll be talking about what it takes to fix these botched cases, and we'll answer your questions on Ask the Doc, no appointments needed. Welcome to Ask the Doc, the show where we encourage our viewers to send in their health questions. I'm Dr. Georgiy Brusovanik, a minimally invasive spine surgeon. Let's start things off with a Facebook question with Mark, who asks, "Hey, Dr. Brew, I had a spinal tumor removed a few months ago, which necessitated some rods and screws to give me structural support. Unfortunately, I've been feeling pain recently, and an MRI shows that one of the screws is pushing on a nerve. What now?" Mark, I'm sorry to hear that you're in pain, but don't worry, Dr. Brew is on the case. So, first, if you had nerve pain right after surgery, right after the screw was placed, then you can blame the screw. But oftentimes, MRI findings showing a screw that's malpositioned aren't accurate. And even if a screw is malpositioned, if it wasn't causing your nerve pain then, it shouldn't be causing it now, most of the time. That's a really tough question though, Mark, and my advice to you is to get a CAT scan. You will see a lot more the interface between the bone and a screw, and I'm sure if you come back to your doc with this question, he'll tell you to do the same. So perhaps get that CAT scan before you go see the doctor. Thank you again for this question, Mark. And to the audience, if screws and rods had to be added for stability, that means that in order to remove the tumor, more and more bone had to be taken to a point where the doctor was concerned about rendering the vertebral part of the spine unstable. All right, our next question comes to us from Anthony, who reached out to us on YouTube. And this question is, "Hi, doctor, this is kind of embarrassing, but I was skating with my girlfriend earlier in the year, and I slipped and fell on my butt. The doctor joked that I didn't have enough padding back there. I broke my coccyx bone. They removed some of it, but I still have some residual pain. Can they create an artificial one?" Hi, Anthony. Thank you for reaching out with your question about your coccyx, and I appreciate this question because it's so relevant to so many people. So first, I want to say that I'm sorry that you went through this procedure. It is almost never that I hear a coccygectomy or removal of the coccyx successful in removing pain related to the coccyx. So why don't we just breeze through a short list of myths that are so commonly heard in my office whenever patients come in with coccyx pain. So one, patients fell years later and they say it's possible that that's why I have a problem. In fact, many will come with a story that they had recent imaging that showed that the coccyx never healed and is pointing in a weird direction. So first of all, I want to give you some great news. Coccyx anatomy is very variable. There's many different kinds, and just because the end, which is usually disconnected from the rest of the sacrum, just because that end is pointing forwards or backward doesn't mean that it's broken. So one, pain can occur years after injury, unlikely with direct trauma on your coccyx. Number two, coccyx pain is never caused by anything else. Well, that's a big one that's totally untrue. Most of the time when patients come with coccyx pain, whether they had procedures or not, they're struggling, they're suffering because the problem isn't where the pain is. In fact, the problem usually stems from an issue higher up in the lower part of the lumbar spine where the nerves from the lumbar discs sometimes refer pain to the area right around your anus, even possibly vagina. So the bottom disc, L5S1, in your lumbar spine can produce this very characteristic coccyx pain. And more so than that, it's very rare that you fracture the coccyx in a fall. The ischium, which is a part of the bone of your pelvis, actually will contact the ground before your coccyx will, unless you fell on a fence or a very sharp object. And finally, a broken coccyx can be replaced with a prosthetic. It doesn't need to be replaced, it shouldn't be replaced, and there is no prosthetic that should ever be used. By the way, and those of you who had those terribly painful intra-anal manipulations of the coccyx, you didn't fail and you didn't go enough. The issue is that these manipulations aren't ethical, are not evidence-based medicine, and definitely are not helpful. Thank you for your question, Anthony. I appreciate such a personal question. All right, Darius reached out to us on our YouTube page, and his question is, hey doc, I have severe degenerative disc disease which necessitated spinal fusion surgery. But unfortunately, the fusion didn't work. So now my doctor wants to go back in and refuse it. Is that even possible? And if so, what is he going to do this time? Darius, this is super common. For patients who have classic spine surgery, failure such as what you've experienced is somewhere in the range of 30-35%. And it's not the hands of the doctor. It's hard to create an unnatural bony milieu within the muscles of the lower back. That's why you see a much higher success in the realm of what we call anterior surgery, where the younger generation of surgeons are really pushing this wave of operations that are done in a minimally invasive fashion, either through the side, through the flank, or through the front. That procedure spares the risk to the nerves and, most importantly, allows a spine surgeon like myself to work with a much more robust bony column, the vertebral column, the discs. They're all in front of the spinal column. So that anterior approach makes a big, big difference. Now, I'm sorry, you've had likely a posterior approach, which is highly associated with a non-union. But I wanted you to hear this because I don't want you to blame yourself. It's never that you didn't do enough physical therapy. And the unfortunate pain that you are experiencing, however, will and should have a happy ending, because a failed back operation, specifically a non-union, where your bones fail to fuse, it can be readily fixed, reliably relieving and improving your symptoms. So talk to your doc and make sure that the way that he's going to fix the problem is going through the front. I really hope it helps. Thank you, Darius. Welcome back. Harrison asks, hi, Dr. Brusovanik. Are there non-surgical ways to fix a failed back surgery? That's a great question, Harrison. So a failed back surgery does include things that aren't structural. For example, you take somebody who's been walking with a walker in a flexed forward posture, and you perform a laminectomy, or you create a little more space for their spinal canal to allow them to walk and stand up straight. Easy procedure. And then when they come to see you a month later, they say that their legs feel great and they recovered, but they're still using a walker. That patient could benefit tremendously from some time with a physical therapist. And that's a non-surgical way to help somebody with a failed back operation. Now, look, as a spine surgeon, I specialize in failed back operations. So in that realm, the realm of people who tried therapy, the realm of people who have an objective issue that is interfering with their quality of life, that realm is mostly surgical. So when patients fly in to have their failed back operations corrected in my clinic in Miami or in New York, usually they plan to have the problem corrected. However, keep in mind that this isn't a science that allows us to use the word always too often. So we always consider non-surgical care. Thank you for your question, Harrison. Sorry. The next question comes to us from Cece, who asks, Dr. B, my first spinal surgery was officially botched. I need to know if it can be actually fixed, or is this something I need to learn to live with? Hi, Cece. Thanks for reaching out with your question. And I'm really sorry to hear that your operation was botched. There's so many ways to make somebody worse with spinal surgery. So please don't think in any way that you are alone in this group. There are a lot of people, especially who had classic spinal surgery, who have complications, who have long-term issues. So the short response to you is you can definitely fix or at least improve your situation. But you need a diagnosis. And if you've already had a botched operation, before you go see a specialist, I would really recommend that you obtain both an MRI as well as a CAT scan of your surgical field. There are important distinctions between the two, but the bottom line is CAT scan is for bones, and you will see detail much, much better. MRI is for soft tissues, and you'll see detail of other things like soft tissues much, much better. So nerves, you really want to get an MRI. Thank you for your question, Cici. And I hope this gives you a lot of confidence and optimism. Next up, we've got another question from our website, allhealthtv.com. You should really check out the site when you get the chance. It's chock full of great information. Vivian asks, hello, Dr. Brusovanik. I'm scheduled to go under the knife in a couple of weeks for scoliosis, and I'll be honest with you, I'm a little scared. I'd like to know what are the most common causes of failed back surgery. Vivian, it's understandable to be scared. That's a big, big undertaking, and let me try and put you at ease. Vivian, getting back to your question, there are two main ways in which I see scoliosis surgery failing. The part of the spine that your doctor tries to knit together, a part of it may fail to knit together, and that's called a non-union, a correctable problem. Another issue is where after a big fusion with implants, screws, and rods, you develop a problem right above or right below. In other words, a healthy level that's adjacent to a fused segment deteriorates. Again, a correctable problem. So a scoliosis operation is a brave undertaking, but you should know that the issues that may be related to surgery are correctable. So if you and your surgeon decide that it is absolutely necessary for your quality of life, to regain balance, to regain height, to improve your posture, and to fix or heal, improve your pain, then the risks may be reasonable. And you need to talk about this in detail with your doc. All right, I hope this gives you some optimism. The next question comes to us from YouTube from Maxim. Dr. Brusovanik, I had spinal surgery a few months back, and I'm having some nerve pain. I'm going in next week for tests to find out if it's nerve damage or nerve inflammation. Is there a difference? And if so, what can be done to help ease the pain? Max, thanks for reaching out with this really important question, and I can really break it down to you very simply. Pain that comes and goes is inflammation. Pain that occurs mostly at night is inflammation. Even occasional tingling and occasional numbness that comes and goes, meaning it will come for a few minutes, maybe an hour, but then it will disappear. That's inflammation. Pain that sticks around, pain that's constant, numbness that's constant, and weakness, even weakness that comes and goes, that's in the realm of nerve damage. That's in the realm of your nerve is sick, and it's reasonable to consider removing the pressure from the nerve. That's a really great question. Thank you, Maxim. Dalia sent us another YouTube question. Dalia asks, Dr. Brusovanik, my husband had a discectomy months ago because he was having pain in his right leg. A few months have passed, and his leg pain came back. Does this mean his surgery was a failure? Dalia, thanks for advocating on behalf of your husband. He's a lucky man. And if you go in for an operation and the pain that you hoped to get rid of comes back, by definition, that means that the operation failed. Now, the word failure sounds like a word that dooms us to having pain, but the reality is that there are inflammatory things that can cause recurrent pain, and there are structural problems which are usually correctable. Now, the most common scenario that I see is a person who has pain when they sit and stand, back pain, who has a discectomy or a laminectomy. That combination, it doesn't work. Laminectomy, decompression, another way to call it a discectomy, it rarely helps with just isolated back pain. It does in some cases, but not always. And if the problem is related to the disc, which would produce pain when you sit, then the operations are usually a failure, where a decompressive operation is done only and the surgeon fails to address the disc. Now look, in modern days we have disc replacement, so we can easily address the disc. But the classic approach where we either remove bone or we fuse the levels, we put screws, it isn't really as applicable either, which is why there's such a hesitation from surgeons around the country to perform disc replacements. This is a great question. Our next spine-related question comes to us from Garth, who reached out via Facebook. Garth wants to know, Doctor, my wife had a laminectomy earlier this year and some hardware was installed for stability. Unfortunately, she's still experiencing pain and it feels like something's off. Is it okay to get a second opinion? Garth, thanks for reaching out with such an important question. You should never hesitate to get a second opinion. Absolutely. And this isn't an insult to your doctor in any way, at least it should never be. A relationship with your doctor is something that should be open and trusting. And if for some reason you feel like you're not obtaining the answers from your doc, definitely seek a second, if a third, and if you need to, a fourth opinion. I really appreciate this question, Garth. So from the point of view of getting a second opinion, if you feel like your questions aren't being addressed, if you feel like you aren't being given truthful answers, I really encourage you to look for answers which are so much easier to obtain these days. Now, next question comes to us from Abra, who messaged us on Instagram. Shalom, Dr. Brusovanik. I had a laminectomy last year and the pain never really went away. So I have to go under the knife or laser again. I want to know if revision surgery is riskier than the first one. Abra, I get this question really often in my practice. And again, it comes from well-meaning surgeons who simply are performing the classic approach to spine surgery, which involves either decompressions or fusions. Now, there's a middle ground. Disc replacement addresses the disc, and the hesitation that I imagine your surgeon had in offering you to go under the knife, again, is palpable because going back in and doing the same thing is not going to produce a different result. Whether you burn things with a laser or cut things with a knife, if the result is that the disc is intact and is still pushing on your nerves, you'll still have pain when you sit, you still have to fidget when you're sitting in the car or around the dinner table, you'll still have to stand up in a flexed forward position and take your time to get back to an upright posture if you're able to do that at all. This is where a lot of my patients who say they've been suffering for years comes from, because the options, the classic options of either decompress or fuse just aren't good enough, and well-meaning surgeons will refuse to apply operations that don't work for patients who are they taken care of. All right, so great question, and my advice to you, Abra, is please talk to your surgeon and make sure that if you are going back under the knife, you are certain that it's going to produce a great outcome. Going back in is usually riskier if it's going through the same surgical field. But theoretically, if you've had a discectomy or laminectomy, which is done through the back, and then you go in to have a disc replacement, the outcomes with disc replacements are actually the same as for patients who did not have previous surgery. In other words, even though it's a revision, since it's done through a separate field, a safer area with no fibrosis, there shouldn't be an issue. Okay, Suri asks via allhealthtv.com. Dr. Brusovanik, how can family members or caregivers help with recovery after surgery? Suri, I think the best would be for the family to be really on the same page as the patient and the same page as the doc. Imagine you come out of disc replacement surgery and the doctor says there are no restrictions, get back to your normal life. And then your family doesn't allow you to regain normal function. That can be hard for the patient and the family. And that disconnect can be reversed, where patients are trying to do more than they should in terms of their post-surgical restrictions, and the family tries to restrict them. It may again produce certain negative emotions. And this is a very sensitive situation with someone who is infirm after surgery. So my best advice for you is really to communicate and make sure that you specifically ask your doc about what restrictions you are to uphold after surgery and what are the realistic expectations. A common scenario is a patient who is in trouble, in pain, and is hesitating to call. There should be a unified voice coming from the patient as well as from the family when it's time to ring the bell and get your doc on the phone. So the other, I think, a reasonable comment to mention is caregiver fatigue. Patients and family move in together after surgery. They allow the patient to convalesce. The patient assumes tasks that he didn't assume before, like just taking care, and the family assumes tasks like they didn't do before, like providing, let's say, nonstop all-day care for someone. This may produce animosity, anger, and caregiver fatigue is real. So talk about that in your family. Take breaks when you're caring for somebody around the clock. I hope this gives you some useful information, Suri. Okay, next question comes to us from Alvin. Alvin reached us through YouTube. Hi, Doc. How long should I wait before considering a revision surgery? Alvin, that's a great question, and I think I can tell you a few useful things on this topic. So, when do you decide that your operation has failed? When is it reasonable to say that the procedure is now a failure, and it's and leads you to another question, which is, at what point do you say that you've had enough, and that the residual pain isn't something that you can live with? As a spine surgeon, I expect a perfect outcome. I expect patients to say that whatever pain they came to me with is now gone. On the other hand, there are complex cases with many causes where you may find some residual ache, some residual pain. And I think it's a really personal decision that only the patient themselves can make, whether that pain interferes with their quality of life enough to do something about it. Now, you may say, I just want to know what the problem is. Why am I still in pain? Maybe after spine surgery, your buttock or your hip pain is actually now the hip joint. Or maybe after your decompression or after your discectomy, the residual disc continued to push on the disc, to push on the nerve, and resulted in continued nerve pain, continued sciatica, continued pain around the buttocks and the lower back. So sometimes I'll see patients who come in with a history of neck surgery, and they say that the neck operation went great. And then I ask them, but do you have this annoying pain deep under the shoulder blade? And you see sometimes their eyes light up because they've been for years living with this mid-back pain under the shoulder blade, thinking that there's no way that could be coming from the original neck operation. Well, this is a very common problem after a neck fusion. And going back to your question, Alvin, it's time to consider revision surgery when you've had enough, when you've reached that point where you are no longer willing to live in pain. And whether you've had spine surgery before or not, I think that's the most common guide. It's rare, super rare, that a patient has to have spine surgery. And it usually occurs in significant trauma settings in the hospital. When you come into the doctor, into his clinic to discuss your pain, it's extremely unusual that you should then run and have an emergency operation. That being said, if you are finding yourselves unable to answer the question, when was the last time you remember having a day with no pain? If you can't answer that question without breaking into tears, then it's really time to consider doing something about it. If you are missing time with your kids, you are unable to perform normal dad activities like, I remember what I had before my operation. I made a decision right then and there that I wasn't going to accept this death by 1,000 cuts, and I was going to correct the problem. Again, I want to appreciate and extend my thank you to everybody who sent their questions. Please don't hesitate, and see you in the next one. Ask the doc, no appointments needed.
Thank you for listening to the Health Channel podcast. We hope this information has been useful. However, please remember that only your doctor can advise you about what is best for you. Do not start, modify, or suspend treatment based on anything you have heard on this podcast. Please join us again soon.